Secretary Becerra, I'm glad to have you before our committee today to provide answers to the questions the American people have, especially this morning, given the alarming reporting that the Supreme Court is planning to end the constitutional right to abortion in this country and overturn Roe v. Wade. If this is true, it will be devastating to many people across the country. I have been warning about this for years, and I want you to know I'm going to keep fighting back with all I have to protect every woman's rights in this country. But people across the country are worried. They need to see leadership from the Biden administration on this, so I hope to hear more from you today about what the administration's plan is to respond to this and protect women's health, because make no mistake, women's lives are on the line. Later this week, you will be hearing from my constituents firsthand coming out to Washington State. We will welcome you there. And Mr. Secretary, I want you to know people are not just worried about this attack on abortion, they're worried about other challenges they're facing as well. Because the past 2 years, to say nothing of the past 2 days, have put such a strain on families and communities in our entire healthcare system. People are depending on the Biden administration for support, for resources, and for real solutions, and I'm pushing to make sure that they get them. After all the hard-won progress we have made in the fight against COVID-19, families in my state and across the country are depending on us to pass urgently needed emergency COVID funding for tests, for treatments, and vaccines to protect our communities across the country. But keeping up the fight against COVID is just the start. We have to learn from this pandemic and strengthen our public health system to make sure we're better prepared with more resources for CDC like this budget proposes, with sustained annual investments for local health departments like my Public Health Infrastructure Saves Lives Act would provide, and with steps like my Bipartisan Prevent Pandemics Act. Because we know all too well things like modern data systems, a robust public health workforce, access to tests and vaccines, clear information, and more can make all the difference when it comes to saving lives during a public health crisis. But Secretary Becerra, the past 2 years have also shown a harsh spotlight on the other healthcare challenges our communities are facing, like the mental health crisis, which the pandemic has made even more devastating, especially for our kids. Over the last 2 years, we have seen a sharp rise in youth mental health emergencies. I've heard from so many parents back home whose kids are just not okay. And over 200,000 kids have had their world shattered by the heartbreaking loss of a parent or a caregiver. And we are already stretched thin when it comes to providing communities the support they need to address these crises. In Washington State, our mental health workforce is only able to meet 17% of our state's needs. We've just got to do better. This budget has crucial support for school-based mental health care and training, which can help reach students in need, mental health support during early childhood, which is such an important time for kids, community health centers, which help families across the country get connected to mental health services, and increased resources for the 988 Suicide Prevention and Crisis Lifeline. I'll be digging in here during questioning and during your visit to Washington State later this week, because I want to know how the administration is doing and what it is doing to address the mental health crisis. Secretary Becerra, I also want to hear more from you about how the administration is working to address our nation's substance use disorder crisis, which has gotten so much worse during this pandemic and has grown even more deadly due to fentanyl. I hear about the tragic consequences of this crisis every single day. Overdose deaths in Washington State have increased by 2/3 since 2019. And nationally, we recently passed the tragic milestone of over 100,000 overdose deaths in 1 year. Our communities are doing what they can, but Mr. Secretary, we desperately need reinforcements. The significant increase in this budget for prevention, treatment, and recovery efforts is absolutely necessary. But it's going to take more to get this done, and that's why I'm working with my Senate colleagues on bipartisan legislation. But I want to hear more from you about your plan to address this crisis. When it comes to women's health, I was relieved to see this budget does include significant resources for the Title X Family Planning Program, which helps get women birth control they need to plan a family on their own terms, life-saving breast and pelvic exams that detect cancer early, and more. Mr. Secretary, I have fought hard to protect the Title X program, and I heard from Washington State patients and providers recently about what this program means in their lives. They told me firsthand how it makes all the difference to people with the tightest budgets who might not have access to this basic, life-saving health care without Title X. It's unthinkable to me anyone would not support this program, but as we are being reminded every day, Mr. Secretary, reproductive health care is under attack at every angle, and we need to be doing everything we can to protect it. So I want to hear more from you today about what we can do to continue strengthening this program and do everything we can to support other programs that protect women's health. That's why I was so pleased to see this budget also increases resources to help lower our nation's unacceptably high maternal mortality rate. And like so many other issues, we know our maternal death rate has been particularly devastating for Black and Native American women, which is why the investments in this budget to advance equity and reduce health disparities are vital, especially the significant proposed increase to CDC's work in this space. This budget also calls for additional support in the fight against HIV/AIDS to increase access to life-saving treatment, reduce new cases, and continue our progress towards ending this epidemic in our country. Finally, I want to make crystal clear how important it is that we invest in childcare and early education programs and bring down those costs for parents. This pandemic has made clear to everyone what I have been saying for years. Quality, affordable childcare is not optional. It is essential for parents, for kids, for our businesses, for our economy, for everyone. When it comes down to it, parents not being able to work because they cannot find childcare is never just a problem for them. It's one more position a small business can't fill, and it's one less link in our supply chain moving things along. That is why I believe this has to be a top priority to help parents get back to work and to lower costs that are such a massive strain on parents' budgets right now. Mr. Secretary, I know this budget includes a boost in child care resources. I was glad to see that, but I need to be clear right now, millions of families across the country are struggling to find or afford child care. Providers are struggling to keep their doors open, and child care workers cannot make ends meet and are leaving their jobs to find better pay. So we've got to go bigger to solve this problem here, and which is why I've been fighting so hard to make a truly historic investment in child care that would bring down costs for families, bring up wages for workers, and all fully paid for simply by asking those at the top to pay their fair share. I'm going to keep pushing to make sure we get that done through reconciliation, because at the end of the day, as happy as I am to see these boosts for child care in this budget, which I fought for a long time as well, it's clear to me we can't just tinker at the edges here. We need bold solutions, and that's why I will keep pushing to deliver on that, just as I am pushing to keep for more progress in all the issues that we'll be talking about today. I always like to say that a budget is a statement of values, and I'm pleased to see this budget does make it crystal clear that the administration's values are in the right place. But families back home need us to do more than just state our values. They need us to live up to them. They need us to act on them with steps that take stress off their shoulders and money back in their pockets and actually solve the problems they are facing. So I look forward to working with you and President Biden to make sure that happens.